Thank you, everybody. It seems like our presentations are over now. And so we have all of those amazing panelists that are with us to answer questions. And there were lots of questions that came through already, team. So I hope you are ready. Some of them I wasn't even able to get approved just yet. So we will absolutely start off with Amanda and Ben, if it's okay for me to pick on you first. There was a question around a comment that you made around, or some data that you made around females in non-binary youth struggling to find space. Did those individuals share what that space would look like for them, how they envisioned that space, and what safety looked like, please?
Unfortunately, that was a finding from our survey data. So we did a crosstab, and that was a significant finding in terms of female identified and non-binary folks being less able to access services. So I can only speculate at this point why that was the case. It may be because there are less beds in Toronto for female identified and young people, but it's definitely an area that we need to look into further. Ben, do you want to add to that?
No, I think that really covers it. And yeah, definitely something that we'll be exploring moving forward.
We definitely did hear that there was a fear that female identified and trans folks were more likely to return to houses or places that they didn't feel safe, just because there was a fear of living in a shelter during the pandemic as well. Yeah.
Fair. Thank you very much. Appreciate that. Nick and team, you all had an absolutely amazing presentation, so thank you so much. I know that there was some questions that you were already able to ask during your presentation, and so just wanting to make sure that we heard you correctly and got your responses. That Nick, you said that in Edmonton, for those young people that are accessing Ben to Arrow, there's a coordinated access system and you're using the by name list. That's correct?
Yeah, you bet, Heidi. So in Edmonton, any individual that is experiencing homelessness, whether they're a youth or an adult, gets screened in by our 200 plus screening partners to do kind of where they're at and what barriers they're facing. They get connected to our coordinated access system, prioritized for a program that's going to kind of fit their needs. And then the programs within our city have the opportunity to select from that list folks that are going to be a good match. The really cool part with our youth housing first is they can grab someone who's chronically homeless or homeless for a day. So they have the freedom and flexibility to choose youth that they're going to have the most impact with. If they have pre-established relationships with them through I know with Bentero, they have some employment programs. If they have a youth that's there, that's identifying that their housing has been destabilized, they can still get connected through coordinated access and then directly into those teams.
That's amazing. Thank you so much. And there was a secondary question around what is the average length of stay and how many young people can you support at any given time in that program, please?
For sure. So Bentero and Native Counseling Services are each independent programs that are offering Indigenous youth housing first. And they have capacity for around 45 youth each. Those programs are a 12-month program is kind of how it's designed, but there's opportunity to either be a shorter intervention if the youth stabilize really quickly, or extend beyond that 12 months as well if they need some extra help or supports or just those last few connections put in place.
That's amazing. Thank you so much. Sorry, just going through all of these again. Amanda, I think that you tackled this one that came in from Camilla. What are some of the ways to start shifting the response? And you boldly said that that is going to be the question maybe for your next study. Did you want to add any more pieces to that?
I mean, I think once I've really got a picture of the complexities of shifting the response, especially in a large urban setting, it can be quite daunting and overwhelming. There's just so many stakeholders, there's so many partners, there's so many people experiencing homelessness that just making that shift is really overwhelming. But I think that the more that we can talk about it, the more that we bring people to the table, the more we draw awareness to the need to change the response. I'm hopeful that that will be a catalyst to start doing some of that work. especially if we can show that it's actually helpful and improves the lives of young people.
Absolutely. Absolutely. Thank you for that. This one is going back to, again, our first group of presenters, and it was the question of, do you have an average, I think this was for the clinician, do you have an average amount of sessions that you see young people for in your clinical capacity?
I was thinking about that question. So I feel like there were maybe like 10% who would like come in for actual sessions. And then there was another handful, maybe double that, that felt like we were doing phone sessions, which, yeah, I think just having a supportive voice in their ear while they're in their safe space, like kind of, you know, helped with the power balance. But then otherwise, like the content was the same. You know, I'd ask the same questions that I would in a session when we were going for a walk. So I had to kind of deconstruct sort of that traditional setting. Content was the same, container different, but yeah, all mental health therapeutic support.
Amazing. Thank you for that. I appreciate that. Again, Ben, there was, Amanda and Ben, there was a really great eye opener when you shared the stat of 48.3% of young people that say families are actually a piece of the puzzle and that we need to be engaging for that healing process. Again, I don't know if this was exactly from your survey or if you were had the ability to ask any follow-up questions, but did young people say what capacity they wanted their families involved or their natural supports involved?
Yeah, it was quite a difference between the staff and the young people. So the young people, I think it was about 27% that said that they wanted to, that would help them in their situation. Many of them qualitatively felt like, you know, their families were stubborn or it wouldn't have helped, or, you know, not really seeing the connection that it would have helped. But so we definitely saw the staff felt it would be more helpful than the young people. Not to say that it wouldn't be helpful for the young people, but it was not the same perception amongst them.
Perfect.
Yeah.
Thank you. Again, to our Edmonton folks, another question has just come in. We're wondering if someone from that group could talk a bit more about their youth advisory groups. How were those groups run, and how was the information that they provided used in informing your programs that you currently offer?
Yeah, absolutely. So the youth advisory group is a collection of folks that have volunteered to be a part of that. We just basically facilitate it and they run it. So it's their group. They kind of direct what they're working on and how they get involved. They do some projects, they do interviews, they set up a podcast. They do all kinds of work outside of what we do. We just kind of help them to navigate. But where they impacted these programs or these innovations is we went directly to them and asked the question, what are we missing, right? What would have, if you had a magic wand with the programs you went through or your personal experience, what could have been done better? What were the barriers? And then to get that input and feedback from them to be able to design the programming. And that's really where that bubbling up of needing Indigenous-led services for Indigenous youth was big, right? Being served by the folks that understand where they're coming from, the challenges they face. And then as Heather so greatly put it, changing the container where the work happens for mental health and normalizing those conversations, right? That was a big barrier. When you talk to some of our young people and you say, well, we got to address your mental health, like that's a big, they immediately will throw a wall up. But introducing Heather right at the start, and that was even a learning curve for that program. We had originally done, you know, some referral processes internally in the program, and it's just created that same barrier, but on a smaller scale. And when we moved her right to the front, that removed that barrier. And again, a lot of that feedback from that youth advisory is where we bring these ideas or bring these approaches to get that feedback from them.
Amazing. Thank you. We have time for just 2 more questions. If all of you people are bringing questions in left, right, and center right now. I'm not too sure who this one is for, but Alana is very interested in learning more about the experience of women with children who were discriminated against, because of occupancy limits. What occupant standards were landlords drawing on? Somebody wants to tackle that, please.
Yeah, I'll tackle on that. Landlords were telling single mothers that children couldn't live in one-bedroom apartments with them when single mothers were only able to afford one bedrooms, as well as saying that every child, like every sibling, needed their own room. So they like a mother with two daughters couldn't have a two-bedroom apartment because it would be too small, which is discriminatory. There is no it's not overcrowding at that point. Even like with bylaws, children are counted as half a person. But many landlords were using that as an excuse to not rent to single mothers who are experiencing homelessness.
Holly, you got me fired up. Like 30 seconds left to go. And I'm like, I did not like anything that you just said, though I respect it. There is clearly a lot of work to do there, because I'm not too sure why IKEA sells double and triple bunk beds then, that are allowed to stack on one another if that's an overcrowding situation. So
It isn't overcrowding situation, and unfortunately it's a very common like talked about practice in landlord groups, and from like participants experiences that they shared, it's way too common, and that's one of the reasons why many of the single parents were still in like shelters and transitioning in and out.
amazing. Camilla, I want you to know that I see you. I see your question. I did have this one here, but I think we're going to be out of time. We'll see if we can push it. I think this goes back to Ben and Amanda, please. When you were talking about the youth sharing what they wanted to see as far as collaboration moving forward, were there any themes? Were there any suggestions, tips, or tricks that young people said, this is what collaboration should look like? Or was there anything that staff said, this is what collaboration should look like?
I think that the young people were less sure what that might look like, but the staff definitely talked about the city working together and having different expertise, different areas. Currently we do have a coordinated access, but it's not youth specific. So I think in terms of different agencies having different specializations possibly, but also just similar program models, certain philosophies, sharing data, working to increase promising practices amongst each other, communicating more around that. We often see the same young people and we don't have congruent service models or even case management. So those were some of the ideas that they came up with.
That's amazing. Thank you. And we do have 1 minute. My clock says 1 minute. I don't know if all clocks are on Calgary time today. But this one goes back to Edmonton. There is a desire to understand a little bit more about the coordinated access system, the youth in the coordinated access system. So if someone could take that on, that would be amazing.
Yeah, for sure. So with our coordinated access system, we really want it to be kind of a one-stop shop for all of our housing programs to be able to ensure that there's options. So we have adult serving programs that can serve 18 plus, but that captures some youth, and that's like our ACT or acute community treatment, our intensive case management and supportive housing programs all draw from that 18 plus. Our youth programs can go all the way down to age 16, so 16 to 24, and they can grab anybody at any acuity. So we didn't want to limit where youth could get support from through that coordinated access system. So every program that kind of works through that system has access to that same list and is able to draw from that list. We know the importance of relationships when working with youth. So if there's an adult program that has a youth engaged at their agency, they already have an existing relationship. We didn't want it to just be limited. Okay, you only can go to a youth housing first. An adult program can work with that individual as well. And similarly with the youth programs, we didn't want to limit it to, okay, they have to be chronically homeless. We wanted to have it wide open so we can get that early intervention, prevention kind of work, but they can also take some of those entrenched youth or youth that have been in the system for a long time to work through that as well. And like any community, there's that gap in service between jumping from a youth serving world to an adult serving world and ministries of children's services and all of that good stuff. So it's just, we tried through our coordinated access system to try to buttress that a little bit just within our housing program. So there's even that interagency or interprogram ability to transfer. Both NCSA and Bent Arrow have adult intensive case management teams and youth teams. So there has been that opportunity to transfer if someone's aging out or needs higher levels of service, to be able to kind of coordinate between different programs as well to make it work as cohesively as we possibly can make it.
That's awesome, Nick. I appreciate you doing an entire system that probably took a decade in a minute and a half. You are greatly appreciated. Team, that is it. That is all of our time. I just want to thank everybody. Our panelists, you are all amazing. I feel so fortunate to work with many of you on this screen and continue that journey with you. And it was lovely to meet some of you for the first time today. And to everybody who showed up, these are amazing individuals. And I hope that you get the opportunity to meet them in person, maybe at the next CAH conference, because they have a lot for us to listen and learn from. Thank you very much, everybody. And we'll hopefully see you in other sessions. Take care. Bye.
Bye.